Hello, everyone. I'm John McCullagh from PositiveLight.com, and we're here today at the annual Gay Men's Sexual Health Alliance Summit. And we've just come out of a plenary session on the implications of intersectionality amongst gay men, and we'll talk about that in a moment. But I'd like to welcome Farouk Khaki to join me today. Farouk is a Toronto lawyer who has clientele mostly comprised of gay men and people who are HIV positive. And I'm just going to read here, so I don't forget it, but intersectionality considers the simultaneous intersections between social difference and identity, as well as the different forms of systemic oppression that reflect relationships of power. Well, intersectionality is not only a theory, but as Farouk reminded us, it's also a lived experience. And in terms of your immigration practice, refugee rights are under siege. And could you talk a little bit about in what way they're under siege and how perhaps they impact the people who come to see you?
Sure. I actually think that refugee and immigration rights are under siege in Canada right now. And we've gone from recognizing that Canada is a settler society built on Aboriginal land. The settlement project has always been about nation building, bringing people in and building the population, bringing diverse people in and building a stronger country. I think that the political framework that we're dealing with today is actually moving away from nation building to a project around cheap disposable labor. Mm-hmm. And so while other aspects of immigration are closing in, the government seems to be wanting to open up these temporary foreign workers. So these are people who can get paid less, who are here for a short period of time. You use their resources, and then you don't need to pay them disability benefits or anything, healthcare or anything like that. And then they go back, and their perk is that they get Canadian experience and they get to live here for a short period of time before they go back. So there's a whole sort of restructuring around visioning on what Canada is and what it could be, which then, of course, impacts on who is desirable and who is not. And part of the immigration process has always been this notion of medical inadmissibility. And so this notion around, and so when we talk about HIV and people who are HIV positive have always, since the beginning of the pandemic, always had issues around accessing immigration as a means of getting to Canada, because they are seen not necessarily as a health risk, but as a burden to Canada's healthcare system, and therefore often excluded from being able to come here regardless of their skills and their abilities and the gifts that they can bring to this country. So one avenue that has been open to PHAs has been the refugee process, right? Where your medical disability, whether it's HIV or anything else, is not a barrier to being able to get refugee protection. Sometimes it might be the foundation of the protection that you get. So you could make a refugee claim based on your HIV status, for example. And certainly considering the stigma and the discrimination that is so pervasive globally, including Canada. But at least in Canada, we have legal protections. In many countries, there are no structures to provide protection, or no effective structures, even if they exist on paper. So the changes that have been taking place to the refugee system are that people are expected to have their hearing within 1 month or 60 days of starting their claim. This is an inordinately short period of time for people to be able to gather their information, their documentation. And as I talked about in my presentation, a lot of people who come to Canada to make refugee claims are often diagnosed in Canada. They were not diagnosed at home, even if they were positive at home, because sometimes those services are not available, or there is a fear and an insecurity, even a danger in accessing those services at home because of the pervasive stigma and discrimination. So I've had clients who've come here to make refugee claims because they're gay or because of domestic violence or for whatever other reason. And in the course of immigration medicals, they're also diagnosed as being HIV positive. And this leaves them, this very short time frame, leaves them in an especially vulnerable position as people living with a disability and a serious medical condition, that what do you negotiate first? Do you negotiate this labyrinth of legal predicaments, or do you deal with your health? And do you get those things in place? And of course, now with this new regime, we're also seeing an undermining of medical access and medical treatment for people with serious medical conditions. Now, people who are HIV positive are still able to access most of the services and treatment that they were able to, but Lana pointed out in her presentation that somebody who's HIV positive, for example, might also be dealing with other health issues. And that's not going to be covered. That is not being covered. So we're hearing stories about people who can get the medication for their cancer treatment, but can't get that medication administered to them covered. Where pregnant women are being told that they can't, they have to pay to enter the hospital to deliver their child. So what if she's positive and she's got health complications? It's not enough that she has a midwife or that she has a healthcare center. She might actually need a greater degree of preparedness and possible intervention around health issues, both for her and her unborn child.
Yeah, and Farouk, an interesting point you made was that so often, because of this short time frame, people who come here as immigrants and refugees don't know what the structures are here and what's available to them, like services such as you provide. And so they integrate immediately into a kind of familial and immigrant community structure that is available to them here and replicate the same kind of lifestyle that they have at home, and then that makes them more vulnerable. Correct?
Absolutely, because what a lot of people, because in many places around the world, people cannot live openly. Arguably, in parts of Canada, you can't live openly as a queer person or as a positive person without facing issues and problems. So a lot of these folk, they come to Canada and their point of contact is somebody from the family or somebody from their community. And on one hand, they've come here because they want something that's different, but at the same time, they don't actually have the know-how, the ability. And sometimes it's a question of the imagination, right? Like, can you believe that if you come from a country where you might be jailed or killed because you're gay, come to another country which will actually give you protection because you're gay? It requires a great leap of faith and a great transition in your imagination to even get you to that place. So people say, some of my clients will come here knowing that they're leaving there, that it's better here, but they don't actually know how much better it is. But anything is going to be better than where they were living, right? So they come here thinking that, because there's also this myth that, North America, Canada, the United States are the lands of milk and honey, that somehow something, hope springs eternal, something will work out. But they don't exactly know what. So they go back into their communities and I have a lot of clients from the Caribbean, and there's this myth in Caribbean communities that they cannot make refugee claims, right? Now, it's true that, in fact, there are very limited number or types of cases which would be successful from the Caribbean. There would be sexual orientation, there would be gender, and there would be HIV. There is no significant political or racial repression on which people could make a refugee claim. So on one hand, they're kind of correct that those kinds of claims would not be viable claims, but that doesn't mean that there are no viable claims from that region. But the common knowledge in their community says that's not an option. So they go underground and then they repeat all the structures that they labored under. They repeat because they're dealing with the same people, they're dealing with the same mentality, they're dealing with the same culture, and they're dealing with the same fears. So they continue to live that life. And of course, that increases that vulnerability, because on one level, you can go into the bathhouses, you can go into Church Street, you can do all of this stuff. So sex all of a sudden becomes a lot freer, a lot more easily available. But accessing the information, the prevention, the care, it's not there. It doesn't connect up.
So what should we be doing differently, would you say, to change this?
My point, intersectionality is not some animal over there that we look at. We all deal with intersectionalities. Our maleness, our language skills, our class, our whatever. So there's not a single person who is a singular unit of or a singular manifestation. Every person is a sum total of their own intersectionalities. And I think the challenge that we face in building a strong Canada, and when I say strong Canada, I'm talking about a just Canada, is making those linkages. Because there's never going to be a person that you meet that you do not have some connection with. And it's building on those connections so that the information that we need to get out. People talk about human rights. I speak about human dignity, right? And so how do we connect on the basis of human dignity and connecting groups, organizations, communities, so that if this group cannot, for some reason, serve the needs of this individual, whether it's a language barrier or a cultural barrier or whatever it is, who can you access? And that should be something that we should be building, is these networks and these connections, because we can't be cultural experts in everything, but we need to be working together so that this information can get out there, so that particular ethno-racial community organization has the resources to be able to address the needs of a gay man from country XYZ who may not speak English, who may not speak French. And so if we're all interconnected this way, that information gets out, that reduces our risk factors, and that also then builds for a healthier society for people, for whatever it is that they're living with, whether it's their HIV status or whether it's that they have no status in the country or they're dealing with violence in some aspect of their life.
Well, Farouk, thank you very much. You've given us some very interesting ideas of how to address these challenges, and I'd like to thank you very much for joining us.
Thank you.
Thank you. And I'm John McCullagh from PositiveLight.com.